know how to prepare and what to prepare?
Yeah, I'll prepare the airway trolley. Anything else you want
And
me to prepare?
thank you. Yeah, I want the crash card, and
Okay.
I would like to call the 2222 and activate the trauma team.
Okay.
And can you please manage the airway as well?
Yes, we'll do that. Thank you.
Thank you. And let's prepare the equipments and don the PPE, and we'll wait for the patient.
Okay. The patient has arrived.
Okay. Is there any handover from the ambulance crew?
No handover.
Okay. Is my patient talking?
The patient is talking.
Okay. And is there any catastrophic hemorrhage?
No, no hemorrhage.
No. My patient is talking, so I'm happy with the airway. And Julie, can you please do the 3-point immobilization of the cervical spine?
Okay, the spine is secured.
Thank you. And can you please put on the oxygen, 15 liters via non-rebreathable mask?
Okay, oxygen applied 15 liters via non-rebreather mask.
Thank you. So I'm talking to the patient. Hello, hi, my name is Dr. Rauf. Can you confirm your name and your age, please?
Patient is just making grunting noises.
Okay. And is the airway secure?
The airway is patent, yes, but the patient is just
Yeah.
making incomprehensible noises.
Okay, he must be in pain. So I will move to the B first. I would like to expose the chest. Julie, can you please put on the cardiac monitor, blood pressure cuff, and pulse oximeter, please?
Okay, cardiac
Thank
monitor,
you.
blood pressure cuff applied.
Thank you. I'm checking the trachea. Is the trachea central?
Yes, the trachea is central.
I'm inspecting the neck veins. The neck veins are distended?
Normal.
Is there any sign of bruise or injury on the neck?
No.
Okay, I'm inspecting the chest. Is there any deformity or bruise or any injury on the chest?
No finding.
No finding. Okay. Is the chest rising bilateral equally?
Yes.
Okay, I am doing the palpation. Is there any surgical emphysema on the chest?
No.
I'm checking the expansion from upside, upper and down. Is the chest expansion bilateral equal?
Yes.
I'm doing the percussion on right upper side, right lower side, left upper side, left lower side. Is there any finding on percussion?
Normal vesicular breathing.
Okay, auscultation. Okay, normal vesicular breathing on auscultation. Okay, I'm assessing the heart sounds. Is there any added sound on the heart? Or
No
how's the heart
added
sound?
sounds.
Okay, so what is the saturation of the patient? Oxygen saturation? SpO2?
92% on air, but you attached oxygen, so now it's 98% on 15 liters of oxygen.
Okay, and what is the respiratory rate?
32.
32. Patient is a bit tachypneic, but I'm happy with the saturation at the moment. So I'll move on to the circulation. What is the heart rate of the patient?
The heart rate is 135.
135. Patient is tachycardic. What is the blood pressure?
The blood pressure is 84 by 50.
84 by 50. Patient is hypotensive. I'm checking the CRT. 1, 2, 3, 4, 5.
4 seconds.
4 seconds. I'm checking the peripheral pulses. How's the peripheral pulses?
Present but feeble.
Okay, I'm checking the peripheries. Are they warm or cold?
Cold.
Cold. Okay. Okay. So Julie, can you please put on the 2 white bore IV cannulas in the antecubital fossas, and please take blood for the blood gas, for the bedside blood gas, bedside glucose, full blood count, uh, RFTs, and electrolytes, coagulation
Okay,
profile, blood grouping, and cross match, please.
I'll do that.
Thank you. So I'm going to inspect the abdomen. I'm inspecting the abdomen. Is there any bruise or any injury on the abdomen?
No finding. on
No finding on the
inspection.
abdomen. Okay. I'm palpating the abdomen. Is the abdomen soft?
The patient grunts when you try and touch the abdomen.
Okay, so it means the patient is having tenderness on the in the abdomen, and is it feel hard?
Yes, a bit tense.
Okay, so do we have the POCUS machine?
The fast scan is
Fast
showing
scan, yeah.
some free fluid in Morrison's pouch.
Okay, so the patient is having tachycardia, patient is tachypneic, patient is hypotensive. So I'm suspecting patient is having shock. Definitely he's having shock, but I'm suspecting he's having hypovolemic shock. There is a possibility he might be bleeding in the abdomen. So I would like to activate the major hemorrhagic protocol. Julie, can you please activate the major hemorrhagic protocol?
Yes, I'll do that. Do
Thank
you want
you.
anything else
And
in the meantime?
yes, and in the meantime, please, do we have the O negative blood in the meantime in the
I
AME?
can ask for it. Yeah, I'll go and see if we can get some.
Yeah, if we have the O negative, please start the O negative blood. And we need to give the tranexamic acid 1 gram IV bolus followed by normal saline push. Can you please do that as well?
Sure, we'll do that. Over how many minutes?
In over 15 to 20 minutes, tranexamic acid over 10 minutes, please.
Okay, thank you. We'll do
Thank
that.
you. I'm going to inspect the pelvis. I'm palpating the pelvis from outside to inside. Is there any pelvic instability?
No,
Okay, I am checking the perineum. Is there any blood on the urethral meatus?
no,
No. Okay, I am checking the long bones. Is there any deformity of long bones? Any
no.
bruise or injury? No. So I would like to call the general surgeons, and I would like to tell them that the patient is having the internal abdominal blunt abdominal injury, and he will need the OR. So I would like to call the OR as well. So I have done the intervention. I will reassess the patient again. How's the airway? Is the airways patent?
Yes, the airway is still patent.
Okay. How's the saturation?
The saturation is 90. Move on to the next station.
Okay. 32-year-old man presents after punching someone in the mouth.